Hi, I'm Dr. Clare Steffen, and I'm a psychologist and a certified drug and alcohol counselor. And today I want to talk about 7 substance use secrets. Now, according to the Diagnostic and Statistics Manual, we define substance use based on increased tolerance, symptoms of withdrawal, and we now look at patterns of craving. So today I'm not going to be talking about it from that clinical perspective. I'm talking about it more from a point of view of behavioral observation that you won't find written in the DSM. And so one of the things we do look at, though, is changes in neurochemistry that happen around substance use and those patterns of use. The first secret I want to talk about is pertaining to a level of excitation. And you might observe this when the person goes to use. And it may be when they're ordering a drink, or they're getting a hold of a substance in some way, or perhaps even if they're just talking about using. And it may be something as simple as like a little hand gesture that's a level of excitation, or something in a facial expression that changes just at the thought of using. The second one is the cycle of avoidance and denial. And they may start to avoid places, or people where they cannot use. And they, might deny the use of the substance and how much they are using. Now, that is rather a clinical kind of definition of it as well. But you'll see that there's many different ways in which that can play out that affect behavior that perhaps don't get clinically tracked. The third secret is the Dr. Jekyll, Mr. Hyde personality changes that you can observe. And the more deeply the person becomes involved in the substance use, the more likely this is to occur. And the more it starts to impact life choices that they make. And the deeper they go into the substance use, the less they have choice around the substance use. So they, in some ways, give up the ability to make healthy choices because of that change in brain chemistry as it becomes more problematic. So, they have more of a need, and they're responding more to the craving and more to the symptoms of withdrawal and that increased tolerance. But they may all the while be telling you, I only use it because it's fun, or it's the way that I like to socialize. And it may be true that it started out this way for some people, but it's very easy for them to cross that gray line and for it to become a substance use problem without even them becoming aware of it. So the fifth one is gaslighting. So blaming others for the use, and saying things like, well, you made me angry and that's why I drank, or that's why I got high. Or if you hadn't done this or that, I wouldn't have used. So along with that, you'll see manipulating behavior and sometimes outright lying to construct a way to be able to use, and then not holding themselves responsible for that use and blaming it on someone else. The sixth little secret is surrounding detachment from self, and perhaps underlying symptoms of depression or anxiety, or maybe even trauma that's never been properly treated. Now, people can go into treatment and still not do the work, or maybe not have a good treatment fitting in terms of the center or the therapist, and not do the work. It can also be that there are family secrets, and that they've been trained not to discuss the trauma, the abuse, the neglect, the abandonment that might be underlying the use pattern. I'm not saying this is true of every single person who becomes, in our old terminology, addicted. It may be, like I said, that it started off more innocently as a pattern of use that was related to entertainment or having fun that slipped over that gray line. But oftentimes I do see that it is related to things that are very painful that people feel they need to keep hidden as a secret. And there could be intergenerational use patterns that are underlying it as well. So the last or the seventh secret is surrounding fear. Fear that if you knew who I really am, you wouldn't like me or you wouldn't love me. Oftentimes, people with addiction are very charismatic. They might have very big personalities, and some of them might have a lot of anger that gets hidden with humor, or the sadness or loss might get hidden with humor, or it might get hidden with grandiosity or very generous behavior, or many other forms of big personalities that, that can hide that behavior rather well. Or it can be the extreme opposite in introversion and hiding away from people so that people won't see who I really am. And oftentimes, the deeper it goes into the substance use pattern, the more inadequate that person feels. So that's the best kept secret. But also the best kept secret is the reason for the use. The substance use is really symptomatic and it's not really the problem. It becomes the problem because it triggers, this increased tolerance and the symptoms of withdrawal and the craving that are how we define substance use. And it, perpetuates the cycle of substance use. But most people don't really know why they use. They will explain it's because this or that happened in my life. But the further away they get from the incident or incidents of what really happened, the more it becomes a rationalization or a justification for the behavior. And change can be extremely difficult because it might mean they have to entirely change their circle of friends and maybe even move away from family and the people that they love. If there are those patterns there that are enabling and creating the kind of environment where it's possible for them to continue the use and not get healthy. So it takes a lot of courage, to change. And the further a person becomes connected to a substance use lifestyle and a way of being, the less authentic they are to their true selves. And it can be extremely difficult to find life balance. Thank you for listening. And I hope you found these 7 symptoms and secrets around substance use patterns as helpful information.